So HIV is a virus. If left untreated and untested for, it can go on and cause what we used to term AIDS. And potentially that can be a death sentence. Nowadays, HIV is incredibly manageable and treatable. People live a normal life expectancy. It's treated. We've got lots of 1 pill once a day remedies. People can have babies, you can have sex and not transmit the virus, but the only way to know if you have HIV or not have HIV is to get a test, which is why this week is so important. There's a lot of stigma that goes along with HIV, partly because it is a sexually transmitted infection in the whole. What I would say is we need to get rid of those assumptions, because we diagnose people from all walks of life with HIV. If you have had sex, then that is a risk factor. Other ways of contracting it are through sharing used drug needles and sometimes by a mother-to-child transmission. So really easy, you can come in here. We operate what we call a screen and go clinic, so you can just ring up and say, I just want a test. You'll come in, you'll have a blood test taken, and we always offer screening for the 4 main STIs, that's HIV, syphilis, gonorrhea and chlamydia. So that'll be a wee test or a self-taken vulvovaginal swab, depending on your biological sex. You know, you don't need to be examined, it's really simple, painless. Obviously, you'll have seen me having a point of care test, so that's a finger prick test. We can't conclusively diagnose HIV on that because we either call it reactive or non-reactive, so we would want a blood test if you did have a reactive test. So most people who came into our department we do a blood test for, so that's a venous blood sample as you would have when you went to your GPs for your full blood count or anything else. If people are very needle phobic, or we're doing testing in the community or via postal kit, for example, that's when we may use point of care tests, which are the finger prick tests, which you saw me have done earlier. So again, that's an option if you really didn't want a venous blood test. So yeah, it's horses for courses. The best one would be the venous sample. HIV can live in your body for a long, long time and not cause any symptoms. We're talking numbers of years. Nobody knows who has a sexually transmitted infection, including HIV, unless you've had a test for it. So you can't look at someone and know that they've got HIV or they haven't got HIV. If you've never had a test, I would strongly recommend this is the week to do it. So I think if we tested the whole of the population, we would stop HIV transmissions completely, because everybody would know their status, and we could get people who live with HIV onto antiretrovirals, and that then stops transmission. So when we treat people with HIV, we make their viral load in their bodies so low that they become non-infectious. You cannot pass the virus on to sexual partners if you're on treatment and your viral load's undetectable. So that's a campaign called U=U, which you can Google and get a bit more information on that. We need to stop stigmatizing people about sexually transmitted infections and HIV in general. You know, sex is a wonderful thing. We shouldn't be walking around being ashamed of any kind of sexual practice, and we just need to stop our preconceptions and judgments about who has it and who doesn't. And people who live with HIV are just as wonderful as before they contracted this virus. It's a virus, it doesn't change who somebody is, and I think it's really sad that we feel that people often feel judged or shamed. It's, you know, we need to chuck that out with the bathwater.